welcome everybody to the second Birds and BBV Bites. There's a lunchtime education session on STIs and bloodborne viruses. My name's Veronica Walsh. I work at the Aboriginal Health Council of WA. And my colleague who is going to be presenting today is Jacqueline Del Bravo. Jacqueline works at Hepatitis WA. So I'm going to hand it over to Jacqueline now. Thanks Jacqueline.
Thanks, Rhona. Thanks for the invite to present today. It's a fun-sized sampler of viral hepatitis, and we have a really short time and 3 viruses to get through. So in further bites, we'll be discussing things more in depth. I've got a nice background of the sexiest looking liver that I could find for Sexual Health Week, and I hope you can all see it. So let's get started. So before we do, I'd like to acknowledge the traditional owners of our lands and pay my respects to, especially to the Whadjuk Noongar people in the area that I'm in today, but all Aboriginal people in Australia and Torres Strait Islanders. Pay my respects to elders past, present and also emerging. So Hepatitis WA, we're an organisation, and my PowerPoint wasn't keeping up. We're an organisation that's been around for around 30 years. We're in Aberdeen Street in Northbridge. We have a range of services. We have a confidential helpline that people can call from both Metro and regional WA. We have 2 numbers, and also if people are in prisons and would like to chat to us, they have a direct contact line to us. We have a clinical team who can provide testing and treatment for viral hepatitis. We have workshops, education, a lot of support services, and most importantly, we have a needle and syringe program. The reason we have a needle and syringe program fully funded by the Australian government is to reduce the spread of bloodborne viruses in our community. Okie doke. So what is hepatitis? So literally, hepatitis means inflammation of the liver. Hepa, liver, and anything itis will usually mean inflammation. As you can see from my sexy liver picture, it sits in the body on the right-hand side, just about here, and it's one of the most important organs that we have. Does over different 500 different processes within our body, removing toxins. It creates energy, aids with digestion, stores essential vitamins and minerals, and gives us energy from carbohydrates. So it's really, really vital. There's nothing that we can be hooked up to, like a dialysis machine, for example, that can keep our liver functioning well if it gets sick or stops working. If that happens, unfortunately, if it stops working, you would pass away or you would need a liver transplant. So it's really vital to look after the one we've got. These are the things that can impact on the liver. Alcohol, if you've ever heard of people having alcohol-induced cirrhosis, that's people who would drink every day in a large amount, and eventually there'd be too much pressure on the liver and they may develop liver damage. Drugs, both legal and illegal, so prescription drugs, over-the-counter drugs and illegal drugs. Viruses, what we're going to focus on today. Diet. If you've heard of fatty liver, I unfortunately have one from eating too much sugar and too much fat in my diet, and I think a little bit too much wine as well. Chemicals can all impact on the liver, as can smoking. Just bear with me, because this is the first time I've been using Teams and my PowerPoints. Okay, there we go, sorry. All right, so these are the bloodborne virus rates in Australia. So HIV, approximately 29,000 people, and that increases by 900 people approximately every year. And it's probably the most well-known of our bloodborne viruses. Hepatitis B, we have about 230,000 people living in Australia with hepatitis B, and that increases by about 7,000 people a year. And hepatitis C, 130,000 people, and that increases by about 10,000 new cases a year. You might be wondering what's been happening over the last few years with hepatitis C, because until about 4 or 5 years ago, there would have been about 200,000 people living with hepatitis C. And what's happened is a cure has been developed. It's tolerated very easily by people. It's in the form of a pill. People take it daily for 3 months, and in 95% of cases, people will be cured from the hepatitis C virus. So it really is remarkable. Moving really quickly along, but we will have more bites coming up in the future with Veronica, and I can talk more in depth about treatments, testing, etc., etc. So with viral hepatitis, we have 3 types in Australia mostly, A, B and C. And I've mentioned hepatitis B and C is in blood. Any guesses what hepatitis A is in? Okie doke, I can hear you all saying saliva, no, sweat, no, tears, no. It's actually in poo, it's in feces. And the method of transmission is oral fecal, which literally means poo to mouth. If you're wondering how that could possibly happen, do you remember the case a few years ago when people ate the frozen berries and people who didn't have immunity to hepatitis A got sick? So these berries came in from overseas. They were infected or they had hepatitis A virus in them, and people without immunity in Australia ate them. What possibly has happened in the factory or where they grew the berries overseas was firstly, they may have fertilised the berries with fertiliser that contained the faeces of a person with hepatitis A. What else may have happened is they may have washed the berries or irrigated the berries, and the water might have been contaminated with the faeces of someone with hepatitis A. Or thirdly, someone working in the factory may have gone to the toilet, didn't wash their hands well, touched all the berries got snap frozen, shipped to Australia. The freezing doesn't kill the virus, and people in Australia ate the berries, I should say, and got sick. Another way it could happen, a little pictorial here, is from people going to the toilet
Right.
with the hepatitis A virus, don't wash their
Okay, I won't be
hands,
long.
and
That's
prepare
okay.
food. So the good news is with hepatitis A is it's vaccine preventable. So people can be vaccinated against it. The other bit of good news is 100% clearance rate. So that means we will all get rid of the virus out of our bodies after a few months. And after that, we will also have immunity. So you can get your immunity from having a vaccination or from having hepatitis A and clearing it. The symptoms, very similar to gastro, nausea, diarrhea, fatigue, fever, etc. But we will all clear it eventually. Most importantly, with hepatitis A is washing your hands, especially before preparing food and before eating, and of course, after going to the toilet. All right, hepatitis B. It's carried in blood and sexual fluids. So sexual fluids being semen and vaginal fluids. So it's quite similar to HIV in that respect, although it's not in breast milk. It's vaccine preventable, and then you will have immunity. Also, if you come in contact with the hepatitis B virus and you do get the hepatitis B, as an adult, 95% of us will clear the hepatitis B virus naturally. And then after that, we'll get immunity from it, so we can't ever get it. But 5% of us will go on as adults, if we come in contact with hepatitis B virus, to have a chronic case of hepatitis B, which means we would need to stay under the care of the doctor. If our blood tests warrant that we need to go on to treatments. There are good treatments available, and also you should have scans of your liver on a regular basis to see what's happening in your liver, because hepatitis B long term can cause cirrhosis and liver cancer. So there's no cure, but there are treatments available. Little babies, if they come into contact with hepatitis B, usually from their mum during birth, they will go on in 90% of the cases to develop chronic hepatitis B. That's why we vaccinate all babies at birth from the year 2000. And we're very lucky in our country that that's available, because in other countries, there are very high rates of hepatitis B because of the vertical transmission mum to bub during birth. And we can talk about more about that in another bite as well. So these are the symptoms: muscle and joint pain, fatigue, nausea, loss of appetite. These symptoms will usually occur many, many years after you've been infected with the hepatitis B virus. Hepatitis C is only in blood, so it's not in sexual fluids. There's no vaccine available for hepatitis C. If you do become infected with the hepatitis C virus as an adult, 25% of us will clear the virus naturally. But that doesn't mean if we get it again, we will clear it again. And you also don't ever get immunity to hepatitis C. So if you have hepatitis C and you clear it, you're not immune. You can get it again and again and again. If you have hepatitis C and you take the cure that's now available and you get cured of hepatitis C, you're still not immune and you can get it again and again and again. This is the treatment. Just tablets, 95% cure rate. Take it for 12 weeks, minimal side effects. But no immunity, but it really is a good news story. These are the symptoms of B and C 15 to 20 years after contracting the virus: fatigue, nausea, depression, anxiety, sensitivity to fats and alcohol. I feel like that most days of the week, except for the jaundice, which is the yellowing of the skin and the eyes. And if I went to the doctor, it's probably unlikely he would be testing me first off the bat for a blood-borne virus. And for many people, a test for a blood-borne virus is something that you need to request specifically from your doctor. Some Aboriginal medical services will include screening for hepatitis B and C in the 715 annual screenings. You would have to ask when you're getting screened if it's going to be included, or it may be offered for you. And it's always just a good idea to have that checked, because we don't know if we have a blood-borne virus unless we get checked. Because if you look at those symptoms, they're very, very everyday sort of benign and random symptoms. All right. So to have transmission of hepatitis C or B, we have a little transmission formula. So first off, you need to have the virus present. Just keeping in mind, standard precautions means anytime we're coming into contact with a person's blood, bodily fluids, we're just going to assume there is a virus present. So we're always, of course, going to be wearing our gloves, and we can talk another day into more standard precautions, risk minimisation, etc., etc. So in hepatitis B, the body fluid is blood and sexual fluids, semen and vaginal fluids. Hepatitis C, it's just blood. And then you need contact. The viruses aren't airborne. They also can't develop in blood. If they're not already present, they don't grow like bacteria. They need to be there. And you need a contact. So you need a point of entry on your body. That could be a cut. And that's why gloves are very important, because we often have little nicks and cuts in our hands that we're unaware of. So you need to have a way that someone else's blood is going to enter your body and get into your bloodstream to have a risk. And then different activities that we do present different risks. The activities are Sharing any injecting equipment is a high risk. 91% of new hepatitis C infections come from people who have shared injecting equipment, and specifically needles. But all of the paraphernalia a person might use to inject drugs could harbour tiny viruses, are microscopic viruses. You don't have to be able to see blood present for the virus to be present. Okay, sorry. Sharing of non-injecting equipment. So if you think of things like glass pipes that people might choose to smoke methamphetamine in, they light them up, they're glass, they're very hot, they put them on their lips and it can burn people's lips. It can make people's lips blister. And the white fluid inside blisters is blood plasma, and that can also contain the virus. And if you think of people are having a heavy session of meth pipe use and sharing it around at a party, and it damages burns more than one person's lip, that's how the virus can be transmitted. Also, if you're snorting a drug and you're using a straw or a $50 bill and you're cutting that very delicate area inside the nose and you're passing it around and there's blood present, that's another way that you can be sharing it with non-injecting drug equipment. Tattooing and piercing, done anywhere besides a registered tattoo studio. And I'd go as far as saying the best and safest place to get a tattoo is in Australia in a registered studio, because people really have to follow some strict guidelines, policies and procedures around how they do tattoo and piercing. In other countries, we're not sure exactly what they have to follow. And even if in places, if you've ever had a really cheap tattoo, they may have used new needles, they were wearing new gloves, you've watched everything, you thought it was safe. Did you know if they were using new ink for every person? Or when one person left, did they recycle the ink and put it back in the bottle and reuse it on other people? The viruses can live inside the ink for a few days and can be transmitted from person to person. If you've ever been into prison and had a prison tattoo, you won't have had access to new ink, new needles, etc. And there's a high risk that you may have contracted a blood-borne virus through prison tattoos. Sharing personal hygiene items, toothbrushes. Have you ever brushed your teeth and your gums have bled? Even if you wash out your toothbrush, you have a look at it, you can't see any blood on it, microscopic amounts of virus can still be on that toothbrush. The next person comes along, picks up the toothbrush, they use it, and that's how they could get the virus into their gums. Sharing things like razors, when you shave your legs and you cut your leg, put the razor down in the shower. If another person comes along and uses it, that's how virus could be transmitted from one person to the other if they also cut themselves. Nail clippers, hair clippers, pretty much anything that can be used by more than one person that can cause injury and bleeding to a person's skin can spread the virus. Fighting and violence. Some sports like boxing and MMA, fighters need to have a blood test every 3 months if they're professional, in a professional fighting capacity. And then they have a pre-game blood test as well. Street fighting, violence, people aren't testing to see whether they've got a blood-borne virus before engaging in fights, and that's a really effective way of sharing blood-borne viruses around. You imagine you punch someone, you cut your knuckle on their teeth, their lip splits open, there's blood around, you're punching a few times, and that's how viruses can be shared from one person to the other. Sport injuries. Have you ever heard of the blood rule? So that's where people engaging in sports, if they get an injury, that makes them bleed on the sporting ground, they need to leave, get cleaned up. If the blood is on their jersey, for example, they need to get changed, and then they'll be assessed to see whether they can join back in the game. A lot of people know about the blood rule, but they don't quite know why it is a rule. If you're providing first aid, always wear gloves if you're coming into contact with a person's blood or bodily fluids. If you didn't have gloves available and someone was bleeding and you still wanted to help them, the best thing you can do is give the person themselves the padding to hold. Say, put that on, apply pressure, and I'll be back while I go and find some gloves or other people to help me. Needle stick injuries. In a community setting where a needle stick injury occurs, there has never been a known case of a person getting a bloodborne virus from a needle stick injury that happens in a park, for example. But you wouldn't want to be the first, and you would still definitely take it seriously, do the appropriate first aid, and then go and seek a baseline blood test the day the injury happens, whether the injury be at work or in the park. Of course, if you're working in healthcare and you are providing injections to people or taking people's blood, if you do then get a needle stick injury, there is a much higher risk, and you would always go and get a baseline blood test. And then you would test again 3 months later, because there is what's called the window period. And that means the time it takes from the day of exposure to someone else's blood to when the virus will show up in a blood test. And sexual contact without using a barrier protection can also be a risk for transmitting viruses. We're going to have some questions afterwards, and also this is our hepatitis helpline that you can call, and we have someone Monday through to Friday who can help you with all your questions. Thank you.
Well, thanks very much, Jacqueline. That was great. It was a lot of information in a short time. We still have a few minutes left, so if there are any questions for Jacqueline, please feel free to put your mic on, or if you can also ask questions in the chat line.
You're welcome.
Oh, that's good. I'm glad you found it informative. Just to let you all know that if you get a chance on Friday in your lunch break, we'll be holding another Birds and BBV bite on hepatitis, on HIV. And Erica from WAC will be presenting HIV under the microscope. And if you're all happy, and maybe you can share that with me either on the chat now or send me an email, we would be more than happy to start doing more of these presentations for you guys. And, we'll give you some ideas on, some topics, and you can sort of have a choice of what you would like. Yeah, so just wondering if there is a cost related to Hep C treatment, or if it's available free of charge. So that's Helen out at Fitzroy Crossing.
Hi, Helen. Yes, there is a cost. The treatment is on the PBS. So it is, I think it's gone up to like $40 a script. So that would be per month, because you need 3 months of treatment if you don't have a healthcare card. And I think it's still $6.60 if you have a healthcare card. But of course, for Aboriginal people under Closing the Gap, no cost with healthcare card. And I do believe, correct me if I'm wrong, Veronica, it's $6.60 if you don't have a concession card. But that's the treatment. And if you go to a bulk billing doctor for your scripts and your blood tests, all the blood tests are bulk billed, and you can also get this done through a nurse practitioner as well. So if you're in a country town and there's not many options to see a GP, nurse practitioners can test, treat, and hopefully that's answered the question. You're welcome.
All right. Well, I guess if there's no more questions, then we've come to the end of our bite. So thanks very much for joining us, Jacqueline. It was great, and definitely hepatitis WA for anybody out there, but particularly in those regional and remote areas where sometimes you feel like you just want to ring through to somebody who's going to be able to give you some good advice. Hepatitis WA on any of, if you have any clients that are needing some education, or any GPs out there that may also need some information and education when they're actually seeing a client, hepatitis WA are there, and they are onto it straight away. So yeah. All right. Well, thanks guys, and thanks for joining us. And if we don't see you on Friday, I'll be in touch. For those that work in our Aboriginal Community Controlled Health Services, you'll hear from me. For those out in the WAC services, I'll make sure that Rudy gets in touch with you guys as well to let you know about what's happening with our bites in the future. Otherwise, enjoy the rest of your day, and yeah, thanks for joining.
Thanks everybody. Bye.
Bye.